Hey, I'm Dr. Wendy, physical therapist, and I am a connective tissue specialist, and I specialize in women's health, and I ask all the questions, why and where did something come from? So even though I'm a manual therapist and I specialize in connective tissue, many of the things are steeped in movement therapies and massage therapies. And so I wanted to show you some information that maybe you hadn't heard before. So this picture here at the very top is Ida Rolf. She is one of the most profound people in our movement therapies that have generated treatments that we're still using today. So if we go back, there are different theories of massage, and there are a couple of groups. So there's autonomic massage, which is a connective tissue massage, which is generally what I do. There is a mechanical massage, which is Rolfing, such as Ida Rolf up here. Originally, she never wanted it to be named Rolfing. She really wanted it to be called structural integration, and it actually didn't become Rolfing until after she had passed. There is also Traeger. Movement-based therapies, such as Pilates, Alexander Technique, and Feldenkrais, are very valuable. Now, this is a movement therapy, but many physical therapists specialize in all these things. So over here, this is what I call the Rolfing baby. It's not a baby, but it's showing that children have a perfect posture because children play and move and they are not stuck in the same activities of daily living that we are. So when you look at this little graphic on the left side, this is where we have postural impairments. We might round our shoulders. We might sway back. We have forward head. And then on the right, if we drop a plumb line, which is just a line from the ceiling, and look at us symmetrically, and do we stack up the way we are supposed to be? Trigger points is something I commonly treat in my practice. I use drain needling in these hyper-irritable muscle fascicles, but trigger points started in the 1930s by Kellgren. And what would happen is they mapped these trigger points in their painful referral areas by injecting these painful spots with a saline and seeing where it referred, and they mapped it. So this later became popular with Janet Travell, who happened to be the doctor to JFK. I don't believe we would talk about trigger points if she didn't take care of JFK. I don't know that it would become as popular. He was known to have low back pain, and she was the personal doctor who would take care of him and treat him. And because of this, I practice the way I do today. Now, David Simons was the other person that helped make trigger points popular. So if you're an information junkie like me and you love history, hit the plus and follow along and learn about women's health and all the reasons we do what we do.